A lot of patients wonder what to expect when they're preparing for shoulder surgery. It's normal to feel anxious or nervous coming up to surgery, and rest assured that my team and I will take really good care of you before, during and after your surgery. Shoulder surgery in general will be done under full anaesthetic. Sometimes it might be supplemented by local anaesthetic around the nerves that supply the shoulder joint, but in general you will be asleep for your surgery. This means that you have to have an empty stomach for the anaesthetic, so we ask patients to fast from the night before if your surgery is going to be in the morning, or you can have a light breakfast early and then fast for the morning if you're going to have afternoon surgery. You will be given written instructions for all of that before the time of your surgery. It's important that you go through those instructions when you're given them, because some of them have a little bit of a lead time before your surgery. For example, if you're on certain medications such as blood thinners, we need to make a plan around those. Also things like hormone replacement therapy or the oral contraceptive pill would need to be stopped a number of weeks before your surgery, so it's important that any of those pre-op instructions are gone through at the time that you discuss them with me, so that if there are any questions or any issues, we can come up with a plan together for how to work around them. On the day of your surgery, you'll come into the hospital fasting. You'll be met by the admissions team and then the nursing team who will admit you and get you ready to come to the operating theatre. It's okay to feel nervous. It's a different environment that most people are not used to, but everybody there is highly trained to take really good care of you. Your surgery is something that is what I do every week and is the main part of my job. It's something that I love doing and that I have spent a long number of years training to do, so you can rest assured that you're in good hands. You won't remember very much of waking up or probably for the rest of the day after the anaesthetic, so it's important that you have somebody to take you home after surgery if you're having day case surgery. A lot of shoulder surgeries can be done as day case surgeries, particularly if you don't live too far from the hospital. For patients having bigger surgeries or patients who live further away, we'll often have you stay overnight in the hospital to allow you time to recover from the anaesthetic and to make sure that your pain is under control after your surgery before we have you head home. There's always access to me and to the hospital 24 hours a day if you have any problems at home, and you'll be given phone numbers where you can contact us. You'll be given a prescription for pain medicine going home. A lot of times that's just to be taken as needed, and some people find they don't actually need very much of it. If you have any problems with the medication, if it doesn't agree with you or if it's not covering your pain fully, then that's when you give us a call and we can sort that out and arrange alternatives for you. After most shoulder surgeries, you'll be in a sling or a shoulder immobilizer for a period of time, and how long you're in that immobilizer depends on the exact type of surgery that you have. Sometimes we use just a simple sling, sometimes we use a sling with a pillow that sits at the side of your body, which takes some tension off of a repair or a reconstruction that you might have had. The physiotherapists in the hospital will see you before you go home and will show you how to manage the immobilizer and the sling. And if I've given instructions for any gentle exercises for you to start, the physiotherapists will demonstrate those to you and make sure that you understand those before you go home. Usually I don't need you to see your own physiotherapist until after you come back to the office to see me for your post-op visit. Usually I'll see you at about 2 or 3 weeks after your surgery to make sure that your incisions are healing well, and we'll get you going on some formal physiotherapy then. I'll give you a note for your own physiotherapist and a program for them to follow so that they know what I did for you and what I want them to work on with you over the coming weeks. Constant communication between me and your physiotherapist is really helpful. If you don't already have a physiotherapist, we'll be able to link you in with somebody who's familiar with shoulder surgery and post-op rehab and who's in your area, so there's no need to worry if you don't already have a physiotherapist. The key point about all of this in terms of your shoulder surgery is that information exchange is constant, and you should feel very comfortable to communicate with us at any point during the process if you have any questions.